Here we are looking at your patella. This is the proximal pull of the patellar cartilage. You can see when I press on the cartilage, it really doesn't indent very much at all. Indents a little bit. That's what we like to see. As we come more distal, you can see how much this indents here. You can see that. That's significant softening of the cartilage here. We'll see if we can't firm that up a little bit. This is often what causes some pain. Here's a little bit of hanging tissue here which we'll remove as well. Most of the pain's coming from here. Then if we look at your patellar tracking, meaning if we watch your patella as we bend and straighten your knee, let me just show you this in better detail here. Here's your kneecap, and we're going to bend down. And I just want to show you right there, you're a little bit off track. Your patella strikes down over the lateral side, and here's where it should be. It should be in the center of this little groove right here on your femur. Then as we bend further, it finally centers in the groove. But it strikes down a little bit lateral here. You can see it right there. It should be more centralized. And then we're going to come around the horn a little bit. I'll show you the meniscus here and everything else. Everything else initially looks pretty good. So coming down your knee, this is the medial side of your knee. You can see the medial meniscus here. Just a little flap of tissue right there. That's completely normal. That's no big deal. Here's your anterior cruciate ligament. I'm going to cross over that. Here's your ACL right in here, which looks completely normal. Then we're going to go to the lateral side or the outside of your knee here. There's a little bit of a tiny tear of the cartilage, of the knee cartilage right here. It's called the lateral meniscal tear. You can see my probe is in it right there. I'll show you this a little bit better detail here. Here it is right here. There's just little tiny flap of tear right here. Otherwise the meniscus looks good and the cartilage looks good. So overall I'd say things look pretty good with the exception of that cartilage on your patella, the patella tracking, and this little tiny meniscal tear right here as well.